In villages, there were usually no electricity and safe water available. My visits also taught me how difficult it was for villagers to reach my hospital or other health facilities. Most of the time, I worked with 3 Malawian nurses in their late 50s. They had worked as nurses for more than 30 years, but they were still very keen to acquire up-to-date nursing knowledge. Although public health services, not private, are the core part of healthcare in Malawi, there is a shortage of health workers most of the time, and the salaries were lower than in the private sector. That's why many health professionals seek better pay and conditions by changing their job or leaving the country. However, even though their pay and conditions were not satisfactory, my colleagues were always proud of being nurses and serving the people in their community. What I learned from them was not only more technical knowledge about maternal child health there, but also the need for a deep sense of responsibility to serve one's local community. Through working in the maternal child health clinic, I came to admire the Malawian mothers' love for their babies. In the antenatal clinic, I sometimes found mothers knitting sweaters or socks for their expectant babies. When a baby was born, relatives and neighbors usually visited the house and shared in the joy. So now I've been studying for Masters of International Public Health at the University of Queensland. In this program, I'm learning disease control, social determinants of health, and the effective management of health programs, especially in the context of resource-poor nations. While studying here, I often recall the nurses and villagers I worked with in Malawi, and I'm very grateful to them for accepting me as their health worker and allowing me to learn from them. In addition, I greatly appreciate the opportunity to study here in Brisbane as an ambassadorial scholar. Through this scholarship program, I've met many generous and inspiring Rotarians trying to make their local and international communities better. So after I finish my master's degree, I hope to emulate you Rotarians by working in developing nations to improve the lives of people lacking the advantages that we take for granted. Thank you very much for listening from me.
Okay, thank you very much.